also thank Benga, who apparently has connected me to this, our noble association. Thank you very much. And thank you, everyone, as you listen to this lecture. Strategies, prospects, and challenges of implementing performance management and quality improvement in health. Let's note that we're talking about health, whether oral health or the other branches of medicine. We're talking about it. And when I dovetail into quality, we are also talking along the same line. And I'm aware that dental clinics are all around. A few are big ones, I'm told, but generally we have private practice and we have those along with our state hospitals. Please. Next slide, please. Thank you. Some of us are already aware. You go to various places of business and you go to the reception, and what you have is somebody just on the phone for such a long time. And I've had personal experience. People have had experiences. Even people go to shops. They pick what they want. They go to the counter to pay. You see somebody who has been on the mobile phone. And I've seen some people who eventually went back, dropped their things, and left. That is the type of attitude many of us display. Sorry. Okay. In a study, just to conceptualize it, and I don't have time to dwell on each line, you discover that it's been grouped into 5 major things. Some of the things that limit our improvement in quality. Limited performance improvement opportunities. Increased work pressure leading to high employee turnover. I think we got a sample of it in that presentation in the scientific session. Lack of standard procedures to measure performance. And as I'm talking, I want to ask us, those of us, either we own hospitals or we are heads of unit, and many of us are. Do we have standard procedures to measure our subordinates? Even to measure our peers? Do we have? Or we stretch it further. Do we even have standard operating manuals? Do we have clinical guidelines? If I come to your hospital, you invite me today. Sorry, there is somebody going on leave. Please excuse me. Can you come and do 1 month locum? Am I going to import my ideas from where I'm coming from and implant it there? Or do you have standard guidelines and procedures that you expect me to follow? And if you remember in the talk by Mr. Osoin yesterday, the legal guy, he mentioned that some of the things a judge will ask is, did what you do, did it conform to your procedure? So it's assumed, therefore, that we have baseline procedures that nobody expects us to go below. Sorry. And then absence of measurable goals. Does your hospital even have a goal for the year? Does it have a long-term goal? Do you even have a mission statement? And then, before we talk of the fact that, do you even, each and every one of us, at the beginning of the year, do we have set goals, smart goals, defined for you or defined by yourself? We now go on to performance management as the first starting point. And I have quite various definitions to aid our understanding of performance management, because the essential thing we're talking about is performance. In actual fact, if you'd excuse me, in actual fact, when you look at what I can refer to as the tripod that supports growth in any establishment, you talk about human resource, you talk about the quality, and that quality depends, it can also go back to the equipment you have. Then you talk about the processes. We are now looking at human resource. How do we harness that human resource? How do we improve on it? How do we ensure that even if we had reached the highest standard in the world, we are able to maintain that standard? And so performance management is a systematic process which a manager can use to get the team members to achieve team objectives, to achieve targets, to improve overall team effectiveness, develop performance capabilities, review and assess team and individual performance or contribution, and very importantly, reward and motivate. Another definition by Armstrong and Barron, it talks about a strategic, it's still definition, an integrated approach to increasing the effectiveness of organizations by improving the performance of the people who work in them, and by developing capabilities of teams and individual contribution. We have other definition, one by Michael Armstrong, which says performance management is a continuous process of improving performance by getting individual and team goals which are aligned to the strategic goals of the organization. Planning performance to achieve the goals, reviewing and assessing progress, and developing the knowledge, skills, and abilities of the people concerned. Sorry. Dockett had this. I think we can now go on. I like this simple definition by Moman and Moman. It says performance management is managing the business. Except that any of us can say we are managing business, but are we retrogressing? Or are we improving? Well, it's a very simple thing to remember. And Walters talk about the process of directing and supporting employees to work as effectively, as efficiently as possible in line with the needs of the organization. Because we can be working and directing, yet it's not aligned to the needs. It's at cross purposes to the needs of the organization. Now, effective management, what are the characteristics? It identifies tasks and accountabilities. It defines competencies necessary to be successful in a position. Yesterday, the lawyer made some reference. This one is not that, but it's still an indirect way. How do we verify the competence of the people that work for us, work with us, or even work above us? You are employing somebody. He just tells you he's a doctor, and that is it. We take it. And we know these days there are many quacks. How do you define the competencies? Do you even review? Because if they had a review process, probably, even without cross-checking asset employment, they might have known that what this guy is saying is at variance to what we expect. And that may sound an alarm bell. Ensuring that team members have the required competencies, having in place a system to develop them, and providing timely feedback on how effectively the team members are applying themselves to whatever the task is on hand. It also accomplishes their tasks and achieves the goals. It rewards and motivates. In the event that performance does not meet establishment requirements, the manager must understand What are the issues involved? Why are we not getting there? Corrective processes will be implemented. Methods will be put in place. Everything to improve overall performance. We've been talking about performance management. But what is performance management system? It is a mechanism for tracking the performance of employees consistently, measurably. It allows the company to ensure that employees and departments working through the organization, they are in synergy. They are moving in the same direction. They are not working at cross purposes. And it enables continuous performance management, but very importantly, it offers us 360-degree performance reviews. These are some of the things if we are not yet doing it, we have to slide into it. Can your subordinate assess you and say you are good? What about your peers? What about the patients or the clients, whatever you call them? Can they assess you? 360, not just one person assessing you. And then improve the frequency of feedback. Ensure a fair process in whatever review, performance review you are having. Make it easy to track the employee performance. And you identify training requirements. He may not be deficient, but you think that this guy has spent 3 years, he's moving on to do some other critical thing. Is he equipped? Or are we just depending on the fact that he has a BDS? He's okay. Are we training? Are we encouraging? And then onboarding. I remember, whenever you enter many of our institutions, you are starting job for the first time. You just left message. That is your desk. And then you jump into the system. I remember one of those who did house jobs said, I didn't know what to do. You don't know what to do. The job is there. Nobody onboards you to tell you when you need things, they are here. When you need help, this is where you seek help. This is the culture of the organization. They say you should report at 8, don't come here at 10 o'clock. This is the culture. So onboarding is very important for us. And when you consider that Deloitte, for those of us, some of us, who have worked with or associated with them, this is a global brand. They were doing performance management and they were reviewing it until they changed into the performance process and they saw a great improvement. In fact, it stated that it has progressed beyond employee satisfaction. It focuses on employee engagement, employee motivation, and highly motivated employees have been proved to offer 125% more productivity than those who are merely satisfied with their jobs. We have talked about work-related stress. Thank God it was presented. I won't bother about that. But organizations that have provided continuous feedback to their employees, they have been found to have about 15% lower turnover of their staff. And this management system, you are able to recall past performance details, feedback mechanisms, and good performance. Now, the guest lecturer, the keynote address of yesterday, he talked about the fact that why should 2 professors work? One is doing 1 hour a day. Another is doing 12 hours a day. By our current system, they get the same remuneration. There is no motivation. Why should I come for 12 hours? It is because there is no performance appraiser. We are not assessed in what we do to give us a reward system. You are just paid. And between you and me, we are doctors. Some of us are on call. You have never visited the hospital for 3 months when you are on call. You leave it to the junior ones. You don't even go and do ward round. At least I know that for medicine. I don't know for dentistry. We don't guide them. We don't relieve them. No wonder the workload is heavy for the junior ones. Please pardon me if I say something odd to us. So we have ratings and scores. I think we can go on. So the business benefits. How? We've talked about the 360-degree. You are able to spot those who are not performing well early enough. Not after 1 year. You spot them and you can invite the person. Or, as we are going to see in the performance management cycle, you are going to see opportunities to engage such a person. And you also identify top performers. I think, of course, those who are not performing well are trained. It doesn't necessarily have to be an external training. If it is, so be it. What about internal training? And when you have training like that, you can note a training course. Has it impacted the individual? Has it impacted your establishment? You are able to assess it. You have increased motivation and morale of employees shoots up. Employees feel more engaged. They know people actually care about their performance, about their output, and they get consistent feedback. Of course, that leads to better employee retention. Never mind that there are no jobs in Nigeria for now. Then you have time savings. This is the initial, when we talk about appraisal, continuous supervision, performance management, when we talk about that, all those are objectives, goals. And so, using that, it has come to, that is the organization on top. There is a plan, hopefully, that whatever objectives you want to achieve for your establishment is set up. And then, individuals draw their own plan along with their manager. You have a review. You track progress. And then you act on whatever they review. Hopefully, it used to be the performance management cycle. So, the cycle, like I've said, you agree on objectives, whatever it is. And then, but a newer form has come, which is continuous performance management cycle. What we're saying is that you don't wait till the end of the year before you engage your employee. You talk about, okay, you check in with your manager or your head of department or whoever your supervisor is, one-on-one. An agreement is set. Your work objectives, he gives you a feedback. Oh, you are doing well here. You are not doing well there. You are absent from duty often. You are this. You are that. And then this checking with your manager can be usually quarterly. The work objectives, you get feedback again. You do another check in 3 months. Your work objectives. Of course, at the end of the year, if the employee still does not measure up, you know that it's not the fault of the head of department. It's not the fault of the manager. When you are asked to check out of the system, you know that you are the one by your performance. Nobody has done you any evil. So, but for effective employee management in this cycle, there has to be a buy-in from the leadership, from the senior management of whatever the establishment is. So management is greatly involved in developing the workers. We ensure that the performance cycle is continuous. It's not just once in a year. If you have never started, you can start once in a year. At least get used to it. And then go into more frequent cycles. Ensure performance conversation. Let there be conversation. Let there be reviews in meaningful areas. Not just, okay, all right, appointment has been, okay, I've seen you, you have come. Okay, thank you. It's all right. You are doing well. Just go. Let there be a meaningful conversation. Why are you always stop flying? Oh, I do this, I do that. You can use such to encourage other people without mentioning name. Why are you always at the bottom of the ladder? Oh, I have family problem. Meaningful conversation, and employees look forward to it. So even the establishment gains, strategically they gain. I don't have time to really digress on them. Administrative-wise, communication-wise, developmental, organization, documentation. What can make the performance management system ineffective or uninspiring? Number one, the system isn't fair or accurate. It is known that you, as the boss, you favor candidate A more than candidate B or staff B. So you have to make it fair. Managers treating employee performance as a ticking box. You just tick it just to fulfill all righteousness. The system is focused more on appraisal than on coaching. You want to coach the person to meet standards. That is the overall aim. The appraisal system is just a route towards that coaching system. Wrong design, absence of integration, lack of leadership commitment, and then ignoring incompetence. It creates a negative experience, especially for the employee. It's time consuming, but I tell you, it's worth it. And you must eliminate natural biases. I think I'll rather go fast so that I can finish. Now, this is the appraisal system. Maybe you have the software. In those days, it used to be paper-based. You as the manager, you have defined how often do we communicate? What are the topics of communication? You'd have listed them for the various employees. How are your goals? Are you achieving them? Are you achieving them? Are they time bound? Are you going according to time? How about the use of technology? Where are you having problems? You know, all those things come into discussion. So that is the appraisal system. And I was privileged. I was a consultant in the teaching hospital and a lecturer before I left when I got appointment with the Shell Corporation, and I left. And then the first year I got there, I was given an appraiser. I didn't know what it was, and that was the truth. And at the end of it all, I saw that my salary had shot up. And I was asking, my salary had shot up. Then they said, you must have gotten a good appraiser. I didn't know what appraiser was. Nobody engaged me on anything. I didn't know. And I started asking, what is appraisal? Many of us, we may not be familiar with it. But at that time, which was in the late 90s, it was just once a year appraiser. But like I said, it has moved on. You are rated. Are you excellent? Are you very good? Are you good? Are you average? Or are you poor? If you are consistently poor for 2-3 years, you are out of the system. You are out. Because you are not meeting according to what the reward system that you are being given. That is the belief. So you have to really measure up to system. So what are my suggestions? For those of us, whether we are in public service, I know there are public service rules, but please find a way. We are bosses, like the vice chancellor is a dental surgeon. Many of us are chief executives of our hospital. If it's a public hospital, find a way of getting approval for goal system. Have goals. Discuss with whoever the leader is, that is your boss, so that you can implement them in your hospital. Prepare staff for performance management. Get them so that they can be motivated. Expect great resistance. The first year you attempt it, expect, because we are used to, whether I work or not, what happens at the end of the month? Salary goes into the bank. Maybe the private system may be better. I mean, the private sector may be better. Salary still goes into the bank. Remain calm and focused because you are going to get a lot of challenges. I don't want to say insult. I don't want to say backbiting. And that is why, like I said earlier, the system has to be fair and seem to be fair. So you don't have any favorite person. The only favorite person is those who are delivering on the set goals. Have a trial run and then start full performance management the following year. Everything is subject to civil service regulation. Now we go to quality improvement. How many minutes, sir, do I have, sir? I asked for 15 minutes. No, I asked. Okay, sir. Quality improvement. Some of us are already familiar with SQHN, Society for Quality in Healthcare in Nigeria. And we may not have very well developed standards for now in the dental sector, but we have abroad. American Dental Association, they have, and I believe that sooner than later it will come into the Nigerian setting. But I mean, we can start moving ahead, because yesterday we used to hear of legal issues. Nobody bothered because nobody was suing. Now today they are suing left, right, and center. Let's better get reorientated from what we used to do to what is coming ahead and get to do the things as per standards. So we have the quality standard. On Tuesday, actually, the one for accreditation was launched. I was to be there, but I couldn't join because that was when my flight to Abuja was. We have safe care for those of lower cost setting. So if you have a dental, this thing is not a big setting, you can go to safe care. Then, now, before I talk on COSASA, this is usually the pyramid. You have the institutions at the base. Then you have assessor organization. Assessor organization is where you have SQHN, Society for Quality in Healthcare. And then they also register, accredited by ISQA, International Society for Quality in Healthcare. That's ISQA. So we register with assessor organization. They assess us and say, you are doing quality. Like yesterday again, they were talking. You get many patients, they leave the hospital, they don't go with discharge summary. When litigations come, we will be in trouble. No discharge summary. Because you're supposed to write a discharge summary, give one to the patient and keep one in the case too. What is your advice for the patient? What is your plan going forward? If the patient goes anywhere, he has nothing to show. You do root canal surgery, or you do whatever you do, oral toileting, whatever it is, you don't even tell the patient doesn't know the technical language of what you have done. The patient ought to know. Those are in assessor organization. That's what we call quality that is coming. And hospitals and clinics are being assessed right there. I quickly talk on KPI. I'm not going to talk fully on all that I have put here. Key performance indicators. What are your key performance indicators? What is it in your establishment? Do you have any? Take, for example, even, okay. Let me just move. Can you please quickly project the key performance indicators? Can you project it for me quickly? After key performance, you show me COSASA so that I can just discuss briefly COSASA with the audience. Please override whatever I am discussing once you are ready. Oh, I wanted to go back and be talking while... So we talk about key performance indication. Please, every unit should have a key performance indicator for the year. As you walk towards it, you will see improvement coming on. You see, inpatient satisfaction. I know that we rarely admit, but it can be outpatient satisfaction with the physician. Do we assess it? Percentage of medical documentation translated. You know, in fact, when I was going through the American Dental Association to see standard, One of the standards is on just consultation and documentation. Consultation and documentation. Many of us, I can use medical to tell you about what a standard documentation is. When you see the patient the first time, what was the time you saw the patient? What was the date? Some of us, you have reviewed case note, you'll be struggling to where is the date this patient was reviewed. You won't see. Not to talk of time, presenting complaint, history of presenting complaint. Then finally, what is your plan? Where is your signature to show that you saw this patient? Many of us don't have. There are criteria to show complete and good. Where let them take it to any court of law, you cannot be faulted. These are standards, and we have them in dentistry as well. So please, let's look at them. And then, okay, when you talk about key performance indicator, you might decide that, look, standards will be our key performance. We want to write standards for this year. Root canal analysis, is that what we call it, ma? Therapy, root canal therapy. What is the standard? I'm not saying that you didn't do it in university. You did it in the dental school. You did it. But in this organization, these are our procedures. Because after all, hospital A may have acquired the latest technology and you have updated your process. Hospital B may not have acquired it. So you cannot be doing the same process like that, especially when you try to advertise the new equipment you've gotten. Sorry, they say we should not use to advertise. So you have that waiting time. What about patient waiting time? Telephone etiquette is part of waiting time that I have seen clinics where patient went to and they went away angrily. Nobody to attend to them after waiting for a long time. What is your waiting time in your own clinic? I know that in death history, it's likely to be better, shorter, because you don't talk about admission, but you still have to define what is your waiting time. If, for example, you started waiting time is 2 hours in my clinic, next year you believe that, look, I want to move to international standard. And you know that international standard, please permit me to use 1 hour. And you are doing 2 hours. You say, no, this is not acceptable. This year, one of our key performance indicators will be 1 hour, 30 minutes. And everybody is walking to work. And you have sensitized and educated your staff about it. And you will see that you are improved. That is quality improvement. Move on to COSASA, please. Quickly. Just the... Sorry. The next one, yes, quickly. That's the PDF file, please. PDF. Thank you. This is, COSASA means, Council of Health of Standards and Accreditation for Southern Africa. And we have used it. I am privileged to be part of that organization. We've used it to accredit hospitals. And hospitals, you just say you are COSASA accredited. It's recognized worldwide. It gives you a rating. And the initial period, which also concerns you, whenever the standards are better developed in Nigeria for dentistry, or rather oral therapy. We talk about management and leadership. There's no establishment that doesn't have management and leadership, human resource support, administrative support, access to that oral care. Is there any access? Is it limited? What is it for? Risk management, resuscitation. And finally, in this initial period that mainly concerns us, we talk of prevention and control of infection. Just to use infection as a point of contact, you go to many clinics. Thank God in Lagos today, it's compulsory that you have sharp instrument, special disposal area. But I have been to many hospitals in those days where needle, not even capped, is just thrown into the waste. No waste segregation. You mix clinical waste with office waste. Office waste is just mere paper that anybody can have. Then you mix it with blood, stain, whatever. That's wrong. Very wrong. We are promoting infection rather than controlling infection. That's just the tip of the iceberg. There are so many things. Many of us don't, maybe with this new virus now, COVID, we now know how to wash hands properly. Many of us never knew how to wash hand and wash it clinically. So these are some of the things. Go towards the end, 34, 38. Can you scroll, please? Can you scroll? 34 towards to 38. Go on, please. Thank you. Go on. We talk of ancillary services, linen management, because we also will have housekeeping, maintenance service, including maintenance of our equipment. They are all for us as well, even if you are in dentistry. It is the specific ones of whatever units or department that need development. These ones are already well developed, and I believe that. Please go to the next slide. Switch me over to the main slide. Thank you. So we are talking about that now. So thank you. Oh, sorry. All right. So when we have that, we are moving on. Now, problem, when you identify a problem that you want to solve, you can have a lot of challenges that you might get along the way. Convincing people, first of all, that there is a problem. You need to convince the people because we are not used to it. Convincing people that there is a solution and the one you have chosen is the correct one. Getting data to back it up. Some of us, we even have good data, but we don't plow it into the system to improve the quality. What do I mean? Let's just take infection control. Sorry, I'm a gynecologist. So I'm going to, you permit me, let me just use CS. You talk about CS rates, cesarean section rate, and the cesarean section infection rate. And the infection rate is as high as 40%. And then, of course, there's a problem. We have gathered the data. We have analyzed it. What do? We have to look at the solution. It must be my target that we have to reduce it, if possible, at least next year. Let it be down to 20%. So I have plowed that rate into the system with solution to try and improve my quality in that my establishment so that I can approach, even if I can't approach world standard, let me approach Nigerian standard. Surprisingly, when I was doing this work, I even saw tribalism, and it's a foreign paper. And I said, tribalism is not only in Nigeria. Ethnicity, we have to eliminate all those things so that we can get quality. I'm sorry, I don't even know where I am. Okay, I think I'm now right. Then you have to remember always, there must be a carrot and there must be a stick so that you can harness the people towards wherever we are going. Sorry, I'm rounding up. Secure sustainability for whatever project. Don't do one project this year. Next year, the project has disappeared. Eventually, when you come back, people will not take you serious. Try and see, at least within your time, let there be sustainability. Consider the side effects of change, which is like, what is our environment? What is the environment I am operating in? And then, again, we have this in an attempt to do quality improvement. We have to look at these factors, but we must improve. Adapt it to your local system. And then as I round up, sir, let me just share this joke so as to wake us up. Are you awake? If you don't listen, you won't get the joke. I think the king of animals is which animal now? The lion. Thank you. The lion king felt he was getting old and that the other animals were not respecting it. So he decided, let me test my strength to be sure that they still know I'm their king. So he grabbed the goat. What did the goat think? Death has come. So he said, who is the king of animals? The goat said, you, lion king. He said, you are correct. You can go. He grabbed the zebra. The zebra thought death had come. Who is the lion king? The zebra said, you. He said, you are correct. So he felt satisfied. He said, okay, let me just try one more. So he went to the elephant. Who is the king? The elephant looked at this lion, grabbed the lion, hit it against the tree, threw it up, and put the foot on the ground. And the elephant said, ask me the question again. And then the lion said, I only asked a question. If you don't know the answer, you don't have to be angry. Thank you, sir. I'm gone. I'm done.
Thank you very much, sir.